All right. So, Dr. Chronicles, Goran, fill me in on this week's story. Because you got to give some advice and you got to give a story. And I think you got a 2 in 1.
Always, baby. So, when's the last time you had a blood test, Indy? Oh my god!
So
this laugh.
This blood test I had, right? This laugh is because I was fucking fuming, right? So I saw this shitty, absolute bitch of a nurse, right? And I mean this.
Good.
I mean this with love.
Like
she was a bitch because I went in. I sat there and she was a prescribing nurse, yeah, because the doctor wasn't available on that day, so I got pushed to her. I said I need a blood test. She said, "What for?" I said, "I've been getting ill repetitively for the last 6 months.
GP practice, yeah?
I keep on getting colds."
Yep. Okay.
Yeah. I said, I keep on getting colds. And she said, okay. And I said, so I need to have a blood test to see what's going on. I want to have everything checked. She said, well, you don't need that. And I was like, no, I think I do. I'd like to have a blood test, please. And she said, no, I don't think you need to have that at all. And I said, but I'm asking you to give me one so I can just have a broad scale check of everything, see if I'm low in anything or anything vitamin-wise that I'm deficient in, etc. She wouldn't give it. I had to plead with her. Eventually, she gave me something, wrote on it and said, here you go, and left. And I was like, you're being difficult for no reason. It's not your money, right? And it's not like I'm asking for no reason. I've got a patient history of not feeling well, so let me go and have it done. Got to the hospital, and the guy said, are you diabetic? I said, no. And he said, right, she's marked you down for a type 2 diabetic test.
Reasonable.
And I'm like, I'm not type 2, I'm not diabetic. But she said, yeah, she's just testing if your insulin's high. And I'm like, but I'm not fucking diabetic. If your insulin's high or if your sugar's high. And I was like, hang on. The only thing that you can ascertain from this blood test is to check if I am diabetic or if my sugar is high. He said, yeah. I was like, so she lied to me. He's like, oh, I wouldn't say that. I was like, yeah, she did. She fully fobbed me off. Yeah. So there you go. That's the last time I had a blood test. I did it anyway because I was like, well, fuck it. I'm in. I may as well do it.
Diabetic.
And that's it.
No,
I'm not diabetic.
It's a reasonable.
What a surprise!
No, it's not a surprise. I mean, tiredness. The problem with being tired.
That's not a reasonable. Shut up, man. That's not a reasonable check.
No.
She lied to me. I said, give me.
Listen.
I said, give me a broad scale check, please.
It's patients like you that get on our tits because you're not medically trained. Number one, okay. So when you say a broad test, there's no magic test we can do that just will find things. Tiredness is a super vague symptom which has hundreds of causes. Fine. So based on that,
I didn't say I was tired, but okay.
Ill for a lot, yeah. What was it?
I've been ill for the last 6 months, like continuously. I kept on getting colds. Kept on having to take time off work.
Your immune state is a bit weakened. That was your main symptom. Okay. Diabetes can give you that, and that's reasonable for a brown person to be checked. Now, what you did wrong, perhaps in this scenario, is that you didn't do the rest of the tests. If you just did one test, that's not reasonable. Someone like you, vitamin D, B12, calcium, like this is a whole barrage of kind of like tests we do for this type of symptom, which is a bit vague and broad. But diabetes definitely would be one of them. Yeah, one of them, not
one
the only
of them.
One,
I understand. Not the sole purpose of the entire blood test.
And who's telling us?
Anyway,
it all depends on the competency of the person you're seeing. If somebody doesn't have knowledge of which blood test to request, right, which you might think is obvious, and you'd hope as the public, whoever you're seeing, should know that. It's not, man. I have junior doctors that don't know which blood test to ask for.
Yes.
So I can only imagine. Anyway, the point was the actual taking of the blood. Tell me about that. How was that?
Smooth. I didn't have any issues. I have seen a couple of nurses that have been like wobbly and then it hurt like badly. But normally I'm okay. Fine. Yeah. I just don't look. I look away.
Fine. You're not someone who gets like kind of hyper itchy or you feel like you're gonna faint or anything like that. Or?
No, I just don't like. I don't like the feeling of the needle going in and then the blood being pulled out. It's just like, okay,
cool. Well, obviously, taking blood is just a really super common thing that we have to do all the time, and it is different when you're on the other side. Like I do not like my blood being taken. I'll get to the point where I'm about to faint and my veins contract and you can't see them. Yeah, I hate it. But taking it, pro level, man. Like do it all the time. No issues there. So I had this 50-year-old Jamaican fellow. He came in big guy, and he'd come in with some chest pain. I was chatting to him, and he wasn't. When somebody comes in chest pain, which is the most common symptom, chest pain and being short of breath are like 90% of what we see that walks into the front door, right? Obviously, not all chest pains are going to be a heart attack, but that's the thing that's on top of our mind. Is it a heart attack? And sometimes when you're asking questions to try and delineate what is serious chest pain and what is like, don't worry about it, it's just a muscle type chest pain. He was kind of in the middle. Like he was kind of at the age where he's a smoker. He's got risk factors. He probably could have some angina, but this doesn't fit into this. And I was like, okay, clinically meaning just by listening and talking to you, I can't really dismiss this without doing a blood test. I'm like, I need to do blood test, right? He lost it, man. Lost it. He was like, oh, Jazz, no, anything with the blood test, no. He wasn't angry. He was just like became really panicky. And he's like, right, I need to go and get a fag. I need to have a fag. I need to get myself ready. I said, right, you got 10 minutes. So he went out and I did my typing of the rest of the case. It was like 20 minutes before the end of my shift. And he came back and then he was still like, I thought the fag would like maybe relax him. He was more tense. And he's like, I don't look at the needle.
Yeah.
But then he kept looking. I was like, why are you looking at it? You don't look at it. Stop looking at it. And this is the point where I've got the tourniquet and I'm just feeling for the vein. There's no needles. There's no needles. And he's still freaking out.
Yeah.
And so then I was like, what music do you like? And he's like, oh, reggae. And I was like, oh, okay. And then I was like, I can have some fun here. Like I can really lighten the mood. So I was like, all right, listen, I'm Punjabi. Have you heard of Punjabi music? And he was like, yeah. I'm under the Bachkan here. And I was like, yeah. It's come a bit on from then, but as we've seen from the Commonwealth Games, it's still banging.
Yeah.
And then I played this song.
Pause for a sec. They had all those songs to choose from, and they threw us back to like the early 2000s with that. And I was like, oh, okay, I get you want to appeal to Middle England. All right, that's fine. Yeah, I just think there's other songs they're going to show. Anyway, sorry, continue. I don't know, man. I don't know. I would have hopefully begged for something. Yeah, maybe, but I guess that's the only hype song. I guess you could pick
PMC's kind of
for a closing ceremony at the Commonwealth Games.
No, the Punjabi eyes.
Yeah,
maybe.
Anyway, sorry, continue.
Maybe,
carry on.
Right.
Maybe.
Yes. So I found a song, a Punjabi song.
So you like have
Punjabi
some fun.
song, which has got some reggae elements. I put it on, and he was like loving life, man. He's like, yeah, jazz, yeah, Jazz. He's like this. There's another patient with another doctor on this side, and they were like, what the hell's going on? I was like, But the reason why I like this, and the reason why I was telling some of my juniors about this is, look, every day when we come in, there is stuff that med school will never prepare you for, right? There's no teaching for this, okay?
Yeah.
But you just got to be super creative, man. Like another junior doctor came to the other day. She's like, "Oh, Jazz, I got this guy. He works in Birmingham, but he's from Leicester. His GP's in Leicester, right? He's going home. He needs a prescription. Hospitals now don't do the green paper like GPs. They have what we call the FP10. Actually, you'll know what that is because you work in a pharmacy. So we can do a prescription, but it's only for the hospital in Birmingham. He lives in Leicester. He's going back. The pharmacy's now closed. Open tomorrow at 7 a.m. I looked at the tablet. It's not like, it's like an acid reflux tablet. It's not the end of the world. So I said, look, your options are you either get him to send him home. You can go to his GP tomorrow, get the prescription. We can give him the discharge paperwork, right? Or why don't you just do him a private prescription? He can go to any pharmacy and just pick it up, right? Because before that, they were like, oh, yeah, we'll ask him to come back tomorrow. So go home today, come back tomorrow to pick up the basic prescription. I was like, where is the logic, man? Have some creativity, give a solution. That's where the fun is in medicine. So put this Punjabi music on for this guy, a 50-year-old chap. And he just didn't notice the needle. Like, another trick when you're taking blood is the alcohol wipe that you use, or the bit of whatever you use to clean the skin. If you get the needle in a sort of a timely fashion, it actually smoothens the introduction of the needle, so you feel it less. And so this gentleman, he actually said, I didn't even feel the needle. So that's something, it's a little hack, it's a nuance. You have to learn these things. Because what they'll teach you in med school is you do it and then you wave it and you wait till it dries, then you go. But what I found is if you do that, it's just painful. So you get it almost to the point where it's dried.
Does it make it more? Does it make the skin more sensitive? Because obviously the pores have opened since you've made it a bit wet, and now they're closing, and then therefore when you're piercing your needle through it, it's going to feel it more. That's me just using
I've never
simple
found it to sort of go
logic.
Like red or angry or cause phlebitis or anything like that. Yeah. So then he was happy, he had his blood test taken, everything was fine in the end. But I thought that was quite nice. It's just something that we have to do every single day. There are nuances to taking blood. There are nice places we like to go. So generally, guys, in your arms, when you're going to have a blood test, it's generally here what we call the ACF, what we call the antecubital fossa.
Yeah. Which is where
Yeah,
the elbow
exactly.
joint
And
is.
the biggest
Yeah.
veins tend to be there. So in an emergency situation, if I need to get access, when we say access, we mean like a cannula or a ventolin, the needle thing that you put intravenous drugs through. We're going to go straight for the ACF because that's where the biggest veins are. Generally, as well, we try not to put the cannulas there because we leave this for blood taking. So our phlebotomists, generally, who take bloods in hospitals when you're in a ward, they like to use these areas, and we try and then put the cannulas in kind of your hand or here, these kind of other areas. The most difficult population to take bloods in is the elderly. So sometimes regularly we get patients over 90. The patients coming in from care homes and things, and whether it's just the age and the skin has lost its kind of turgor elasticity, the collagen has gone, or it's that they've had so much steroids over their kind of life. And when I say steroids, I don't mean like bodybuilding steroids. I mean like prednisolone for COPD.
No, you mean like
that kind of thing, or they have rheumatoid arthritis or whatever. It becomes very skin thin, becomes very, very thin. And often what you get is these super, super wobbly veins. So you see the vein, right? You see it and you're like, yeah, I can feel the vein. You put the needle in and the vein just moves. And you're like, ah, shit. And this
that's painful.
Up, you get this massive thing. You're like, oh, so you get a hematoma collection of blood. You haven't got any blood coming. You're like, got to go again. Here's the hack, right? So you can use it in young people as well, but you don't need it generally in younger people. In the elderly people, when you find the vein that you want, so say it's that vein on my hand there, you give it a little pull. The pulling of it keeps the vein taut.
Oh, you pull the skin away.
Yeah, keeps it taut. So when your needle goes in, it's less likely to jump around because the vein is now taut. Otherwise, when it's loose, it just goes side to side. So that's a little hack. I always tell my junior doctors, just make sure the vein's straight. Now, the other thing, more important, kind of again for the younger population, is it's not necessarily the veins you can see which are the best veins. So the most superficial vein might be too small for taking blood or for a cannula. It's the veins you can feel. So one thing we get taught, but you only develop over time, is the bounce, the feeling of the vein, right? So what I will do, and what I say to juniors to get wrong most is apply the tourniquet. What most people do wrong is they don't leave the tourniquet on for a longer period of time. I'm not saying leave it on so the arm goes numb and black and falls off. No. Leave it on, get them to drop their hand, do a couple of these clenches, get the blood flowing. Then what you're doing is I almost don't even look. I look away and I start feeling the arm, and I'm just doing this kind of pokey thing like this. And I'm feeling, when I think I feel a vein, then I stop and then I give it a few pokes. So I go, I'm trying to differentiate between what feels like a muscle or a tendon.
Man, this is just like how they do in films.
No,
they're about to shoot up them sweet drugs.
Not the flick. No, not the flick. Just a little tap. Little tap. I can't really get this on the camera properly. But yeah, that's it. A little tap. I'm like, bouncy. If it's bouncy, it's a vein. That's important. If somebody's not medically trained in an emergency situation, if you're trying to do something with a vein, remember a vein does not have a pulse. If you feel something with a pulse, that's an artery. Do not stick a needle into that because it's going to go. Which sometimes does happen by accident. So sometimes we've cannulated arteries. It's not the end of the world, but you got to put a lot of pressure on. Otherwise it will bleed, and you're like, why is the blood coming out of that person? Why is it so red? So yeah, the next time.
Why is it so red? Isn't all blood red?
There's this thing about arterial blood being oxygenated, so it's a bit brighter than venous blood, which is supposed to be darker. It's all hooey though. Blood is the same color.
Oh yeah, of course. That old conundrum. Yeah.
What you have to
have that conversation daily, me.
What we have to end up doing is we have to test the blood sample to see the oxygen level. If the oxygen level is super high, it's arterial blood, so that's not good. If it's low, then it's venous blood, and you're okay. It's all good. Something we have to do every single day, blood taking. Hopefully we get to the point where we can just do like a diabetic check where you just prick and you get all the blood tests. It's what we call a point of care test. It's like it takes a drop of blood.
That would be nice. That would be nice. Imagine that.
Because often, like people come to.
Why do you need so much blood? Is that because it's needed for like wide scale testing?
There's a lot of tests, and all different tests have to be on their own part of the blood themselves. But when you think about it, it's not actually a lot of blood. It looks like a lot of blood in the bottles, but compared to what you have in your circulating volume, like 5 liters worth of blood in your body, it's peanuts, man. You're talking like a few mils. Yeah. It looks like a lot because they're in the bottles, but it's not a lot of blood. But yeah, hopefully that time comes where we get instant results. Because at the moment, I send that sample off to that guy I was telling you about. Then it's another 2-3 hours waiting for that to be analyzed. That's the wait time. I can't make that happen any faster. Do you know what I mean? Like, if you've come in and I think you might be having a heart attack, I need to make sure you're not having a heart attack. I'm going to do the blood test. Like, I can't make that go faster, and it's in your interest to wait for that result. Often you get people saying, "Oh, can I go home?"
But if you have a kit that could just like simply drop it on, bam, gives you all the results.
Coming, man. Like,
imagine that.
We didn't have what we have now 50 years ago.
That'd be as you like to say, a game changer. There we go. Speaking of game changers, let's change the segment. All right, wrap that. Next.